This is Cannaramic, and we're bringing you cannabis like you've never seen it before.
I am so delighted today because we are talking with Payleen Thorogood. And Payleen is really, really interesting. I love her because she and I went to the same school, went to Cornell University, trained as an engineer. And now in the cannabis space, you have this foundation, the Holistic Research and Education Foundation, where you're doing research on CBD and cannabis and the impacts in various areas. So we'll talk about that. You also have Manna by Autism Botanics, which is a CBD oil company with wonderful products from with Hawaiian infusions, which I'm so excited about. And you kind of took this new wave approach to yourself. You just reinvented yourself into the cannabis space. So you got to tell us about how you kind of went there, the whole background about how you broke the leg, your husband broke his leg or somebody. So tell us all about the background.
Sure. Well, first of all, thank you so much for having me. It is truly a pleasure to connect with you guys. Yes, my background is in technology. I was in big data and analytics as a tech executive and eventually as a CEO for a software company for 20 years. So my focus has always been about understanding data, understanding correlations, understanding how different bits of data really relate to one another. Mm-hmm. About 3+ years ago, my husband did not break his leg. His aorta burst. He almost died. So it was slightly more traumatic than breaking a leg. And so after, he ended up having to have 3 separate open heart surgeries. And I'm so thankful for modern medicine to be able to open him up and basically turn him into a bionic man, and he is able to function. It's amazing. He's alive because of that. Wow. But in the same vein, I saw that the pain medication that was given after these incredible surgeries were not all that effective, and they had some very adverse effects on him. Mm-hmm. At the same time, one of our really good friends and now my partner at Holistic Research and Education Foundation, Andy Norda, visited us and started talking about CBD and how CBD has helped his son with cerebral palsy incredibly. At this point, Max, the little boy, was 11 years old, non-communicative, he has a lot of spasticity. And over the course of a very short amount of time, Max was able to develop tremendously. He was able to start using his spastic hand. He was able to do many things that the doctors had never expected him to do.
This is because Max was regularly using CBD oil in his treatment with his father. His father was working with him with it.
Exactly, but for 11 years they didn't even know about it. So as soon as they started using CBD, initially topically and then using it orally, tremendous improvements. And Andy himself started using it, and he started realizing how much his anxiety had lowered. And of course, having a kid with cerebral palsy does increase your anxiety. So huge improvements in Max, huge improvements in Andy. And so he suggested that for my husband, given his pain situation after the various open heart surgeries. And we saw some great benefits there. So this was an interesting time, given I had been in the crazy world of tech, very much interested in understanding how things work, given my background as an engineer and in data. I was very curious about how does this work? How does it have all these very different impacts?
Right.
Found out from people that they were using it for everything from epilepsy to pain to insomnia. I knew how it worked for my husband. I saw how it worked for Max. So there was a lot of curiosity. And so Andy and I decided to basically do something that most people don't just jump into, really create a foundation to understand not just if CBD works. We basically already saw that it worked for some people some of the time, but given that whole big data curiosity, we wanted to understand how and why it works.
Okay, I've got to stop you there because, like you said, most people don't just say, hey, you know what, let me just switch my life around completely from engineering. And this is similar in the sense that it's looking for information, but you started a foundation for research and education into CBD and cannabis and how it can help and work in various scenarios.
Right.
Wow.
And it's been a great journey. And I feel like it's really providing that mechanistic approach is a wonderful way of blending in the East and the West, really using a modern medicine and being able to leverage modern medicine and the power of it to demystify how CBD, how cannabis really works, so that we don't just say it works some of the time for some conditions. We understand the specifics as to what the mechanisms are and why it works more for some people than other people.
Now that's a huge undertaking. I mean, you know, we know Dr. Raphael Mechoulam did his initial research into cannabis, and he learned some things, and we've learned some things over the years, but there's so much still we don't know.
Absolutely.
You know, how do you wrap your mind around like all of these different variables? It's a plant, right? So there's different things about it. There's different, I guess, what you would call terpenes and strains and things like that. How do you go into the process of learning about this plant in a way that actually we can use the information?
Sure. First of all, let me back up and indicate that it is not Andy and I who are doing this work, right? So we are the people behind it, and we pulled together an incredible medical advisory committee of some renowned doctors, researchers, people who've been in this industry, as well as people who haven't been in this industry, but they have amazing backgrounds in endocrinology, in neuroscience, etc., so that we have this great group of people. And then we work with some of the top research universities in the country, such as UC San Diego, University of Utah, and many others, so that we are surrounding ourselves with big thinkers who really want to have this mechanistic approach to understand the how and the why. Right. That's how we're doing it. But what we're doing is bringing in a lot of great questions around it. So we're not doing clinical only research. We're really focused on doing multidisciplinary research, bringing in, neuroscience, bringing in genomics, bringing in imaging, advanced imaging, so that we can really collect all the data points that are available to us thanks to modern science, but use them in a new way to be able to explore how this works in a more holistic manner.
Right. So you've got, on one hand, you've got your medical advisory board, which has, you know, like you talked about, doctors and physicians, at the leading hospitals and universities around the country. I might add. We look at your medical advisory board. So then you have your research universities that work with you to actually do the research, and they collaborate with those doctors and advisors to some extent to put together, I guess, the overall scope of what this is going to be about and
the
to
study design. Okay. The study design has been basically vetted by our medical advisory committee, and in some cases at the beginning was really co-defined by them. So I feel like we're very engaged. So it is not, we're not just funding research and saying good luck. We're very much engaged from the beginning all the way.
And these doctors, you know, again, we look at traditional doctors and traditional medicine. It's a lot about pharmaceutical drugs. This is what they're learning in school. I guess these doctors have a more broad perspective. They believe in, or they have some sort of positive outlook on the possibilities for CBD.
I believe they have much more of a systems approach, because, you know, I'd say a lot, you know, one of the, you know, reasons a lot of people give a lot of grief to modern medicine is that it's very, focused on a single organ, single system. It's very symptoms focused. And I feel like, the people that we're working with are those, big thinkers who really focus on a systems approach, because everything in our body obviously interrelates. And therefore, if you have a specific condition, it's likely due to many other elements that may not be in balance or functioning correctly in your body. So I think they do have that big systems approach, which really helps.
Okay, so we've got a few studies going on right now. Well, before we get into that, I want to kind of understand a little bit, help make sure folks understand how CBD works in our bodies, kind of talk a little bit about the endocannabinoid system and how things work in that regard. So can you give us a bit of a primer?
Of course. CBD, and actually cannabis in general, works through the endocannabinoid system. It is a major biological system found in all mammals. It's a relatively new discovery. It was really found in the late 1980s, early 1990s, and not a ton of research has gone into it, probably partially because cannabis has been on, the Schedule I list. But based on what we know, it is the largest single receptor system in our body. And it basically regulates pretty much every major organ and cell in our body. It regulates the nervous system, the endocrine system, our digestive system, our immune system.
How did all of this, this major system that regulates all of this, how did it not show up until like the 80s? Like, how did we miss it over all of those years?
It may be because we were very, once again, narrowly focusing on, and I feel like this is given, the system works through our entire body. There are two types of receptors, CB1 and CB2. The CB1 receptors are primarily in our brain and our central nervous system. CB2 receptors are in the peripheral nervous system, as well as our gut and our immune cells. So they are really everywhere, and possibly we didn't realize that they worked together to regulate all the different functions in our body, but they do. And they work with both endocannabinoids, which are the mimic hormones, the CBD, THC, et cetera, that we produce internally,
so
as well as
right.
we
So we have
our own.
Right, and those are called
endocannabinoids.
Endocannabinoids,
and
they,
inside,
right, inside, and then those are the T2AG, right?
Yes.
And anandamide.
Correct.
Right? So those are the ones we're producing in our body. So this is a system that we've always had. It actually works. It operates on its own. So how does CBD taking it externally interact with that system?
Well, I mean, the way I look at it from a lay person's perspective, given I'm not the doctor or the PhD here, is, whether it's environmental factors or stress or other things, change our, body's balance. We go out of balance. I have vitamin D deficiency, as my doctors tell me. So things obviously go out of balance in our body, right? So we do have endocannabinoid deficiency, except that we don't know it because nobody's measuring it. Just like 10 years ago, I don't think anybody was really measuring your vitamin D level. So once again, I feel like we're measuring more and more new data points and realizing the importance of those data points for our health. And that's a constantly evolving element. And so CBD and THC and other cannabinoids, the 150 plus cannabinoids that exist in cannabis, supplement, they're phytocannabinoids coming from a plant. They supplement the endocannabinoids in our body to create the balance that the endocannabinoids are intent to do through the system.
Okay, so maybe in the future there'll be some sort of test where we can find out whether we are deficient in 2AG or anandamide in our system, and we need external CBD. That's a long way off, right?
I don't know how far off it is, but I agree that is definitely where we are headed. And some of the work that at least our research is doing is trying to understand from blood tests and things like that, understanding how susceptible we are and how much phytocannabinoids will be able to affect us. So we're really trying to use part of our research thinking into being able to easily identify if certain people are going to be able to benefit from this or not based on simple blood tests. But you're right, it is at least a few years off.
Okay, so we can get CBD from both the whole cannabis plant that includes the THC, or we can get it from the hemp plant that is usually very, very low THC, right? And people are mostly right now, because of federal regulations, what we see on the market is mostly hemp derived.
That's right. So cannabis is really the plant, and there's a legal line in the sand that separates marijuana from hemp. And hemp has less than 0.3% THC. And per the 2018 Farm Bill, it is now legal to grow hemp across the United States. And CBD and the hemp plant is no longer on the Schedule 1 list. So CBD can come, of course, from both sides, but the products that we see in the market that are not in dispensaries, but just in normal places that anybody can shop at, are the hemp-derived CBD products.
Okay, so we've got, just for people to understand, the hemp-derived products are the ones that are producing most of the things in the marketplace. So you're not going to have THC at high levels. And just for clarity, THC is where we get our psychoactive elements. When you have that in the what you call marijuana plant, the THC is what makes us feel high. That is
correct. And there are also a lot of new and upcoming research talking about and exploring the benefits of THC as well. It is definitely has a psychoactive element, and this conversation is more focused on CBD. But there are benefits to the cannabis plant, and it's not the individual compounds, but really how these compounds come together in that full spectrum version directly from the plant that we're most interested in at Holistic.
Right. So you are doing work you've got a few studies going on right now. You've got autism, CBD and autism, right? And I want to definitely get into that. Isn't this Autism Awareness period month? I think May is Autism Awareness Month. And you've also got one on the brain effects of cannabinoids, right? With the University of Utah. And there's some other things coming out of Pike. So let's talk about your autism research. That in particular, as I was speaking with one of the researchers, is not being done on organic CBD in the sense of from the plant. It's being done on a synthetic form of CBD, correct?
That is correct. That is how it started right now. We're definitely looking into adding in also full spectrum so that we can compare and contrast if the autistic kids who are going to be part of the study have a different effect. But it's starting with an isolate to really look into how CBD may affect autistic kids. But our desire is to be able to also introduce full spectrum into the study for that comparative effect.
Now, you decided to do autism in particular as you were looking at all the different options, because there's tons of things to research, right? Why the autism approach? Why was that important to look at that?
Well, a few different reasons. First of all, it is definitely becoming more and more common. I mean, it's about 1 in 50 kids have autism, and it doesn't just affect the kids, it affects the entire family. So there's definitely a huge societal impact. And also, it is a neurodevelopmental disease. So during the conversations with the doctors and the researchers, our expectation was that as we better understand how CBD may affect in autism and provide relief, we may also get some great clues as to how it may help with other neurodevelopmental diseases. So we wanted to use that as an area where we start looking into CBD's effect on overall neurodevelopmental diseases with a specific focus on autism.
On autism. So have there been any anecdotal, these people are using CBD for autism and we're starting to see effects? Was that one of the motivations that kind of drove you there?
Yes, there was first of all, there's definitely a lot of anecdotal evidence, but perhaps even more significantly, last April 2018, a really great preclinical study from Israel by Dr. Aaron came out that indicated that CBD, as used in this pretty significant population of 60 plus kids, showed a behavioral outbreak decrease, reduced the communication problems significantly, as well as reduced disruptive behaviors in kids. So they were able to see that anywhere from 30 to 70% of the kids were improving significantly across each of these areas. So Israel decided to go ahead with a more of a full clinical study. And what we wanted to do was, knowing that clearly it's affecting significant segments of the population in the study, we wanted to understand the mechanisms. Why are some of these kids, why are 60% of the kids reducing their their behavioral outbreaks? So we wanted to really understand genetic differences in the kids, how CBD may actually be improving the neuroinflammation, whether it's actually changing signaling rates in the neural networks to make it more effective so that there is more of a balance in the neural network signaling. Mm-hmm. Those are some of the hypotheses that our amazing researchers and doctors came up with. And we thought this mechanistic approach would then be able to let us know why some of these kids were truly improving, and then be able to hopefully eventually have blood tests that would indicate for autistic kids if CBD will actually be indeed beneficial for them or not, because we don't expect it's going to work for everyone, but it has great potential for a significant population. We want to understand what those people share in common so that it can be much more targeted, far more personalized, as medicine is, of course, going towards.
Of course. So these children were taking CBD every day. Was it a certain dosage that they were on that was achieving some effects? maybe something that we can say practically, this is what they were doing and this is the benefits they were seeing. What was the dosage?
Well, they are taking, so the dosage amount does vary. The good news is they have been using up to 600 plus milligrams per day with no side effects. So the good news is that even very high levels of CBD have been shown to be safe and tolerated, and obviously more tests are required, but it's really a good indicator that there's some safety associated with it. But any doctor who's been working with CBD that I've talked to says that the dosages really vary, and that also may be something to do with how we are all different from one another. So the recommendation is start low and increase as you need to, knowing that even at high doses, no significant side effects have been observed in these studies where people were using very high doses in some cases.
And actually, the World Health Organization in 2018 said CBD is safe and well tolerated in humans and animals and not associated with any negative public health effects. So how important was that announcement from the World Health Organization? I mean, that's a big deal.
It is a big deal, especially because the expert committee on drug dependence of the WHO, the World Health Organization, had spent several years reviewing the research available from many countries, because the US has not done as much research as maybe some of the other countries, again, due to the status. But because of that, WHO being a global body was able to look at a lot of research around the globe and understand safety, tolerability across, for people, for animals, looking at abuse potential, which is of course huge given, we have an opioid crisis, obviously, that's taking place in this country and elsewhere. So they really want to look at that as well as understand its potential for therapeutic use. And so they looked at the safety aspects as well as assess the therapeutic benefits. And I think what came out of that last summer is that epilepsy is the one area I think we all know that it appears to work quite well in. There's even an FDA-approved drug, as you know. But there's also many other areas of benefits that there's preliminary evidence. Everything from Alzheimer's to insomnia to chronic pain to Parkinson's to reducing organ transplant rejection. So there are many areas where there is significant potential evidence. And to me, that's where we need to do additional research to understand, is there really, that great benefit? And if so, how does that vary from person to person? And how can we really learn more about it to have that personalized medicine approach for this, very potent plant that has great therapeutic potential?
Absolutely. I mean, the WHO usually will say something like generally regarded as safe. But they actually gave this pretty much their seal of approval, which gives the opportunity for people to use it without having to worry about ill effects. So parents can use it with their children who have anxiety, ADHD, autism. We don't know a lot right now because a lot needs to be studied, but we know that there are impacts, and that's what your other study is going to look at, the impact on brain effects of cannabinoids, right? So you've got the one on autism, which we're going to actually be talking to one of your researchers about that. And then we have the study on the brain effects of cannabinoids. So let's talk about that one.
Sure. So I think, anybody who's tried THC or even CBD would know that the effects are different. It varies from person to person. So the purpose behind the study is really understanding the personalized effects of CBD, THC as individual compounds, as well as a full spectrum, whole plant cannabis delivery, to understand how and why people respond differently and how it affects everything from pain to anxiety to executive function to attention in healthy adults. We want to leverage this as a baseline to understand how changes in receptor density in our body, the endocannabinoid receptor density in our brain, is our ability to absorb CBD or THC into our blood, other neuroinflammatory factors, how they may actually affect how CBD provides that effect on us. So it's a very unique study for us to basically create a baseline on how CBD and THC and a combination thereof works on different people differently, leveraging some very advanced imaging technologies, including PET scans, as well as fMRI or functional MRI, to be able to understand how people's brains light up differently, as well as how the neural transmission rates change from person to person.
Okay. So this is a study you're doing with the University of Utah.
Correct.
And you're looking at healthy individuals. Now, I guess there's a profile, right? That would be an individual who doesn't have heart disease, high cholesterol, et cetera. So you're looking for like a baseline type of person.
That's correct. And both on the autism and this study, there's inclusion and exclusion criteria that the doctors come up with. So they make sure, you know, they don't have specific diseases, they are of a certain age range, etc. So they definitely provide the inclusion criteria and exclusion criteria as they select the candidates for the clinical studies. And then, but they have enough diversity in the populations as well. So we have an understanding of how it really shows that variance, that personalized differences that we're really looking to see.
So at the end of the study, by the way, this study is actually ongoing right now, correct?
Correct. Yes, it is.
And how much longer do we have before we get some real juicy information?
We're really hoping to at least start getting the initial sense before the end of this year. And then the hope is that the publication will happen about this time next year. So within a year, we should be able to publish the results, but be able to start talking about it before the end of 2019 is the hope.
Okay, so you are having these normal, I guess, healthy folks and watching how their brain changes as they take CBD, what parts of the brains light up, how it impacts. I guess there's going to be some subjective analysis as to how they feel in terms of their attention, their focus, because those things are not very measurable are those things measurable by MRI?
We're using both PET scanning and fMRI. So between the two, we should be able to understand which parts of the brain light up. And we know which parts of the brain are responsible for pain or stress or attention, etc. So, and with PET scan, the part that is working more lights up brighter. So they'll be able to actually see the differences in different people's brains as they start lighting up brighter in specific areas of the brain that are responsible for specific functions. So it is actually quite objective, which is the best part. And then with the fMRI, we'll be able to look at the transmission rates, the differences between the different parts of the brain. And one of the hypotheses from the researchers is that CBD is actually going to create a higher independence between different parts of the brain, increasing focus, increasing attention, and increasing resiliency. So they're really expecting that CBD is going to be this element that instead of everything kind of working together and having that higher stress, it really creates that independence and really providing a relief and being able to function more efficiently and more effectively. That's one of the hypotheses.
So out of this study, we could potentially have information that can help people who have ADHD, you know, yes, who are suffering with anxiety, and really be able to give them some direction as to how they can take it, you know, maybe dosages and, you know, frequency and things of that nature that they can work with in lieu of or possibly in addition to their current medication, pharmaceutical medication.
That's exactly right. And because this study also, of course, incorporates blood tests, et cetera, we'll be able to look at how much CBD they have in their blood serum. We're going to be able to look at their inflammatory markers, et cetera, to be able to really identify how they vary from a, you know, genetic perspective, from an, you know, being able to absorb CBD, et cetera, perspective, as well as seeing what's happening in their brain. Put all that data together to provide this very unique profile as to how different people respond differently.
Wow, this is so mind-blowing. And this
really is,
you know, what we need, because you know, you're in the stores, everybody has heard about CBD at this point, or unless they were under a rock, they should have heard about it. And it's in everything. It's in gummies, it's in chocolate, it's, you know, they have all kind of mechanisms to provide people with CBD. But I think there's an overwhelmingness because people are looking at, well, this says 25 milligrams on this package, and I've heard that it's good for anxiety. I don't know how to take it. So the work you're doing is really going to help us to maybe get a little bit closer to where we need to be able to understand how we can use this effectively.
We absolutely hope so. But one thing you just mentioned, and I want to comment on that, is yes, there are, I believe, close to 2,000 CBD brands out there right now, and they all claim things which they really shouldn't, because we haven't proven a whole lot yet.
Mm-hmm.
They also indicate what they have in terms of how many milligrams, etc. But JAMA, Journal of American Medical Association survey that was conducted indicated there are a lot of products out there that are not what they seem. They may not have the CBD concentration they claim. They may have actually higher than advertised THC concentrations. They may have, other things, heavy metals, pesticides, etc. So our concern is that given this hype, this frenzy about CBD, some of which is well-founded because we're seeing such benefit, is creating also an undercurrent of not the highest quality products. There are clearly some great brands out there without a question, but at the same time, there are also some entrants, I think, who are probably trying to take advantage of the green rush. So it is really important that we collectively, working with all the appropriate bodies out there, to create certification programs to really make sure that the CBD that we are taking is what we think it is. That's public safety. I mean, that's a very, very critical component of something we need to look at, because we can't just be excited, this is great, it works. We don't know what we're taking, because there is no requirement for truth and labeling at this point for this supplement.
Right. So, and that's where the federal government comes in. Well, there's a state level right now. There's a lot of things happening on a state level. The federal level, they just took it in and made CBD or hemp derived out of Schedule 1. So, are we looking at the federal government to kind of start to give us direction as to how we should have these things labeled for regular use?
I believe there needs to be a government and public or nonprofit collaboration. We're definitely looking into how we can help as a nonprofit to at least create awareness in the population as to what they should be looking for. Instead of saying, oh, it says so on the label, is there independent ISO certified lab data that shows that it really does indeed carry the appropriate amount of CBD? Does it show that it's clean of pesticides or heavy metals, etc.? So they need to understand that lab testing is or should be a requirement, and they should ask for it. The consumers can start demanding things. Or they should try to understand, where does this hemp coming from? Until the hemp bill, hemp growing in the US was limited, once again, due to federal regulation. A lot of CBD was coming from outside the country and maybe from not the best agricultural practice places around the world. So where's the CBD coming from? Was it grown in clean soil? I mean, remember, hemp is a bioaccumulator, which means it actually takes whatever's in the soil. That's great if you're using it to clean the soil, not so great if you're using it to create medicine or create a supplement. So there are questions I think we need to create awareness in consumers about, as they look at the supplement for pain relief, for insomnia, maybe for some other serious conditions. Are they really getting what they think they're getting? Are they getting the amount of CBD that comes in a clean form? And I feel like that's something we need to address quickly, because the percentage of the American population that is taking a CBD, or at least has tried CBD, is growing at a crazy rate. So this has some really serious public safety impact.
And I think that the actual community of people like you in CBD and cannabis, it's important for you guys to drive it, because the federal government isn't necessarily as versed as you are. So if you're not driving it, then they can impose rules and regulations that really don't make sense for the uses of the product or for how you are creating the product. So that definitely needs to happen. It reminds me of the GMO project for what was done because regulation wasn't coming down as quickly from the government. The organizations the organizations that were part of the non-GMO community decided they were going to take the initiative, and they created this, non-GMO project. And they basically said, if it has this label, you can be assured of these things. maybe something like that could work in the cannabis industry, CBD industry.
That's what we're thinking. It's going to take some effort, but that's absolutely our thinking. And we're hoping that with the right collaborations with some people we started already talking to, that we can create such a movement to be able to establish what we need to look at, what these brands need to comply with, so that when we go to the grocery store or the supplement store and buy CBD, you are getting what you're thinking you're getting. And I think that is, in addition to all this research to demonstrate how CBD works, the other part is, of course, making sure that CBD is indeed safe and you're getting what you think you're getting.
Right, right. And I just want to give a quick plug, Mana Botanics, the wonderful CBD oil company you have. I love the fact that you've kind of coupled CBD with like Hawaiian derived elements. I mean, it just makes it so cool. Macadamia oil with CBD oil. Traditionally, we see it with a coconut oil or MCT oil. That's so brilliant, and it's just wonderful and refreshing.
We also infuse it, yes, it is really delicious, but we also infuse it with other botanicals that are known to have anti-inflammatory or anti-anxiety effects, such as turmeric or a passion flower, cinnamon, etc. So we're also trying to, that's why it's a botanicals company. We want to be able to leverage the other goodness of the earth, not just CBD, and create the synergistic effect between various products. And we also, I mean, as Andy and I approached our partners in Hawaii on this, we wanted to be able to make sure we had products that we felt safe about taking ourselves. So we thought, in addition to our research, let's also create a company that we know is clean and pure.
Absolutely. That was very self-serving, but we can all buy it. It's available online, and I'm excited about the turmeric. I take turmeric every day, so that's another way to take the turmeric. Now, just in terms back to the research, what's the future of Holistic Research and Education Foundation? What's on the horizon besides these two studies we talked about?
There's several studies we're contemplating right now, and they're all exciting. One of the ones that I feel like that is probably going to attract a lot of attention is focused on the opioid crisis. Oh. There's, again, preliminary evidence that CBD may work to reduce the opioid cravings. Not to mention, of course, much of the opioid addictions have really come from people with chronic pain, starting pain medication and then unfortunately becoming addicted. So yes. The hope here is being able to leverage CBD for pain reduction, but also seeing how it may reduce the cravings for opioids at the same time. So that is one study that we're super excited about that we're hoping to be able to fund. Another one is around insomnia. There are like 30 plus million Americans. I was one of them. I no longer am, because CBD really helps me, but who suffer from insomnia, which creates not just inefficiency and a miserable night, but really has some, long-term health effects. So we really want to understand how, again, it may help insomnia. Another really exciting study that we want to be able to work with is around taxane-induced neuropathy, and that, it comes from chemotherapy that creates the neuropathy. And there is preliminary evidence that shows that CBD, cannabis, etc., may be able to reduce it so that chemotherapy and natural medicine like cannabis can work together to be able to help cancer patients to be able to take both traditional medicine as well as modern medicine together. So that's another one we really want to be able to jump into and understand what are the specific biomarkers that may indicate that you're really going to benefit from the CBD treatments or the cannabis treatments in these specific cases. So a lot of really exciting projects, from opioid to sleep to neuropathy, that we're looking at, as well as, of course, the certification project that we're at the beginning stages of.
This is such exciting work. I mean, I wish I could be doing this. My mind is not like yours.
Come join me.
We went to the same school, but no, I'm not. I wasn't in the engineering program. And also, you get to work in this beautiful environment out there. I tell you, I am excited about the work you're doing. This is the type of work that's really going to have practical benefit for everyday people. I know that traditionally, when we look at pharmaceutical drugs, when they come out, they have to go through double-blind, placebo-controlled trials in order for us to be able to experience this. But because the WHO said that it's safe for people to use, we can actually start to use it now. And with the information you're providing, your studies, be able to see some benefits in our everyday lives on a practical basis.
And our studies are actually being done in that double-blind, placebo-controlled manner as well, so that the studies we're doing for the specific conditions are going to be very robust clinically, as well as we'll have these other genomics, imaging, et cetera, data points to have that personalized medicine approach. So we are, we're going forward based on what we heard from WHO, but at the same time, we want to prove it, want to demonstrate it, and understand the mechanisms at play for each and every condition.
Wow, I can't wait till these studies come out. I mean, we're going to be waiting with bated breath. In the meantime, we're going to have some CBD oil and just see how it helps us and titrate it accordingly. And we're so happy that you have helped us to understand what you're doing and the research at Cannaramic. We're hoping that people were able to see cannabis in a way that they've never seen it before and are as excited as we are about your work. So thank you so much, Baleen, and all the people that work with you and for all that you do for the cannabis space.
Thank you for the opportunity. I so enjoyed the interview. I really appreciate it.